Sheep Incorporated Healthcare Center is a nonprofit free healthcare clinic that serves the underinsured and uninsured in Pittsburgh, Pennsylvania. We have nurses, pharmacists, physicians, we have occupational therapists and also physical therapists that all volunteer their time to be able to help the uninsured community. So it's really great. So I got involved at SHEEP. It is my last year of pharmacy school. I'm graduating in May. So as I'm transitioning on into residency, I wanted to find more clinical experience for myself. And one of my friends volunteered at SHEEP and made me aware of the clinic. So that's kind of how I got involved with them. And my role at the clinic is basically, I'm a pharmacy intern there. I work along with the pharmacist and we both volunteer our time to complete medication reconciliations for the patients. We also can kind of just be of help to any area. I've done vaccinations there as well. So we kind of just help all things medication wise. So we get our patients while they're waiting, we go through their med list, make sure their allergies are up to date, that we don't have any old medications on their list, and answer any questions that they might have. So what prompted me to seek out proper drug disposal options for my patients was I was noticing that a lot of patients were coming into the clinic either with their leftover medications, or they were calling in and asking if we could take their leftover medications. But unfortunately, the clinic is not a registered take-back facility. And they're actually, take-back facilities are kind of hard to come by. They're far and few between. And for a lot of our patients, they don't have vehicles or access to transportation to get them to those take-back facilities. So that's kind of when I started to think about something maybe I could do to help our patients in that regard. And then while I was doing a presentation on naloxone for one of my rotations for pharmacy school, I stumbled upon the product DisposeRx. And when I was reading on the website about it, I was like, this is perfect for the clinic. Our patients would get great use out of this. So that's kind of how I stumbled upon the product and how it has a great fit at the clinic for our patients. So the points that really resonate with our patients around proper drug disposal really are how it can help people in their family. So a lot of people kind of don't really think about medication disposal and how it'll affect them. But when we bring up the fact that if they have children or grandchildren in the house, that accidental overdoses and poisonings are very common with leftover medications. And that point really hits home with a lot of them because it's not really about them. They're now thinking about their family and how they can help protect their loved ones. So that's a really, really key point I like to make. So yeah, the packets have gone over great at the clinic since we got them in stock and been starting to hand them out. All the patients love them, and I haven't had one person turn me down yet when I've offered them. They all can think of a way they'll get to use them, but one of the main ones that really sticks out and resonates with me was I had a woman who came into the clinic and I was educating her about DisposeRx, and she started to get upset and told me that her husband had recently just passed away and she wasn't sure how she was going to get rid of his medications. It was something, that she hadn't even thought about, but me bringing this up to her, kind of hit that chord. And she said that she was so grateful that she had this product and she could go home and, get rid of them so she didn't have to, have another thing on her plate. So I hadn't even thought about that as a use for this product, with people having their loved ones pass and having their medications at home, but just goes to show another reason why we can use these packets and how helpful they are. So that one was really touching to hear. So the thing I like best about the DisposeRx educational materials and the packets is definitely how user-friendly they are. When I'm explaining to patients how to use the packets and I have the flyers that DisposeRx sent to us, it's kind of right on there and makes it very easy to read. It's not too wordy. It's not, a journal that someone has to sort through. You have the facts right on there that kind of stick out to you, saying, this many overdoses occur a year, and you have the facts on there. So that kind of grabs the patient's attention. And then as for the instructions, a lot of our patients might speak different languages or not have high health literacy. So to have photos and diagrams is such a huge help for our patient population that we serve. Of course. So definitely having conversations with our patients about naloxone and overdose. I think a lot of people, since it's not huge in the media anymore, think that it's not a problem, but it's actually the exact opposite. We've seen the number of opioid overdoses skyrocket throughout the COVID-19 pandemic. And so now more than ever, it's important that us as pharmacists and me as a pharmacy student about to become a pharmacist are having these conversations with our patients. Having the DisposeRx product is a great segue to these conversations. I find that approaching people with a DisposeRx is a much easier conversation to have than to bring up about having a naloxone prescription. So that's one of the reasons why I love the product, because it doesn't make people kind of have that stigma that naloxone does, but it is there for them and they have access to something that can potentially stop an overdose. So it's a great product.